Knee arthritis is a very common problem that patients get, especially as they age. Usually a combination of small injuries over time. Sometimes it can be a large injury, if they have a fracture or, tear their ACL or some sort of ligamentous injury. Can sometimes start this process where the cartilage, which covers the ends of the bones, can slowly start to wear out over time. This wearing out of the cartilage can cause grinding, it can cause pain. Usually it starts out kind of as a dull ache, but with time usually progresses as the cartilage continues to wear out. Certainly knee replacements are a big surgery, and nobody wants to have surgery, but when all the other things stop working and they're not able to sleep at night, they're not able to go to work, do their day-to-day activities, is when people start considering knee replacements. What we do is we take what's left of the cartilage and we cut off that 1 centimeter of bone or so and replace it with a metal cap on the femur and a metal cap on the tibia. Those are the two bones in the knees, the thigh bone and the lower leg bone. And then there's usually a piece of plastic that goes in between, so essentially it becomes metal against plastic instead of bone rubbing against bone. These procedures have some pain and some recovery associated with them, but usually they're very good for getting good pain relief long term and allowing people to return to those day-to-day activities that they enjoy doing.